let's finish talking about symptoms. In our previous videos, we were describing symptoms, asking about them, and giving instructions when we have to talk about a treatment for a patient. And in this video, we're going to be talking about SAOP notes. What is this? First, I want you to observe these different types of reports that I have about patients. On this one, we can see the information or the personal information about a patient. So this is the first thing that we learn in this course. So talking about the patients, next of kin, some information about his or her habits, and then we have here some information about the medical history. On this other report, we can talk about vital signs, but observe this new one, okay? Again, we have the patient name, obviously, his or her date of birth. In this case, I think Kyle is a boy. And then we have a record number, okay? This is a control that normally hospitals have. And then observe, we have this subjective, objective, assessment, and plan. What is this? This is an SOAP report. What is this? These are documents that nurses use to record information about a patient. As I was telling you, it contains 4 points. Subjective, that is the part what the patient reports about his or her problem. Obviously, this part includes the symptoms that the patient is feeling. Sometimes it is the next of kin who describes this. Then we have objective, that is what the nurse can see, feel, hear, touch, and measure about the patient. Then we have the assessment, that it is the summary that you will create about the patient's immediate medical problems. It is related to this part, okay? And then the plan is what the nurse plans to do or treat the patient's symptoms and help with the problem. So these are the 4 parts that an SOAP report contains. Observe the following examples. On this side, we have this patient whose name is Nancy Sussman. And here we have her information. In this case, in the subjective part, it says that I've been overweight since the birth of my twin daughters in 2001, and I get frustrated trying to get in a diet. Then here we have the objective, and then we have here the weight, the height, the ideal body weight, the cholesterol, and the blood pressure. Here we have something interesting. Nothing of what I mentioned is written completely, so we're going to check this in a second. Then we have this part about the assessment that says that it is obese at a 183% of ideal body weight with hypercholesterolemia. Oops, I don't know how to pronounce this, but I know you understand this part. And then with P, we have the plan, that is long-term goal, that is to change lifestyle habits to lose at least 27 kilograms over 10-month period, okay? So this is an example of an SOAP note. Here we have another one, okay? In the subjective part, we have this patient that is saying that he's having pain in his right knee for 4 months. The objective, here we have again the weight, the height. We have the range of motion, because we're talking about a pain in the knee. Then we have the assessment, that is possible osteoarthritis with rule out rheumatoid arthritis, okay? And now what is the plan? Here we have a different schema from this one. We have blood work set rate rheumatoid factor. This is a blood test that can show inflammatory activity in the body. Then we have an X-ray in the right knee, and we have here posterior and anterior and lateral X-ray, and then we have the medicine, ibuprofen, and then here we have the time that he will gonna be using it, 3 times a day by mouth, and then recheck in 3 months, okay? So these are the elements that are included in this SAOP note. And as I was telling you a moment ago, obviously nurses use a lot of abbreviations. For example, here we have ideal body weight, cholesterol, range of motion, rule out, posterior anterior, no known drug allergies, known allergies, blood sugar, urinary analysis, right, left, milligram, TID, that is 3 times a day, PO by mouth, effective airway clearance, twice a day, airways breathing circulation, effective breathing pattern, oxygen, as required, an hour. In addition to this, don't forget that in unit number 3, we were working with some other abbreviations regarding vital signs, blood pressure, respiratory rate, temperature, weight, oxygen, and well, signature is not an abbreviation, so you need to learn all of these abbreviations to understand this kind of SOAP notes. So, are you ready to practice?